We're following some breaking vaccine-related news.
Yeah, Pfizer is asking the FDA to authorize its COVID vaccine booster for all adults.
You might remember that company previously asked the FDA to grant emergency use for everyone who's 16 and older, but in the end, it was only authorized for people who are high risk or 65 or older.
The FDA is probably going to grant Pfizer's request, and the New York Times is reporting tonight that approval could come before Thanksgiving.
As more people are getting vaccinated, we're starting to see more school districts around central Indiana make that mask mandate optional for their students.
Brownsburg Community Schools now taking a more cautious approach.
Rich Nye explains why kids are going to be wearing their masks there from now until Christmas break.
3, 2, 1, sharing time is done. Excellent.
Students at White Lick Elementary and all Brownsburg schools must wear masks in class to prevent sharing the coronavirus.
Absolutely, masks have declined the number of quarantine kids that we have on any given time. I think we topped out at almost 800 kids in a week that were quarantined. Now we get down to 25, 30. Because they're wearing a mask, they don't have to be quarantined.
But Monday night, the Brownsburg School Board approved the superintendent's recommendation to withdraw the mask requirement.
The mask requirement is not going away right away. Masks become optional in Brownsburg schools December 20th, after the end of the first semester.
With the new vaccination being available for students ages 5 through 11, it allows parents a reasonable amount of time to get their students vaccinated before the masks are not required. So if a family chooses to get their student vaccinated, they have plenty of time to get that done.
Maybe I could quietly slip away.
The mask requirement will not so quietly slip away after this semester for all students pre-kindergarten through 12th grade. That gives families until January 4th. 8 weeks to get the 2 doses of kids' COVID vaccine given 3 weeks apart. Students that are vaccinated with no symptoms don't have to quarantine, even if they are close contacts of a positive case.
It's up to the parents and what the parents have decided to do for their own students. So there's not a requirement on vaccinations, but if that's what a parent chooses to do, then they will not be quarantined.
Brownsburg also hopes that keeping masks on until Christmas break will help avoid any spikes in cases and quarantines after Thanksgiving family gatherings that might disrupt attendance during high school final exams.
Thank you, Rich. There's another Hendricks County school that's making a similar decision for some of its students. Avon schools are only requiring masks at elementary and intermediate schools right now, and they plan to keep those requirements in place until students between the ages of 5 and 11 have had 3 months to get vaccinated.
The deadline for that federal vaccine mandate is looming right now for millions of businesses and healthcare facilities.
Last week, President Biden's administration announced 2 mandates, one for businesses with 100 or more employees.
The other mandate is for healthcare centers that receive Medicare and Medicaid, but many states are pushing back, including Indiana.
Tonight, our Lauren Kostick reports how one Greensburg retirement center already made it work implementing their own mandate, and they did so months ago.
At Morning Breeze Retirement Community and Healthcare Center, it's been a long year and a half. Masks and safety a top priority, and the vaccine is no different.
When it arrived in December of 2020, I had several team members immediately become vaccinated.
And by August, Holly Whitcamper says 78% of her staff at the Greensburg facility was fully vaccinated.
My director of nursing and I talked about it and decided this is the time. We're 78% vaccinated. Let's set a date.
Picking October 14th as the deadline for their 80-member team. And it worked. The staff here is now 98% fully vaccinated. The director said they did lose a few people after the mandate, but majority got the shot.
You know, we paid attention to open positions and our numbers prior to mandating with the fear that we could have some issues, but there wasn't. Everybody got behind us and did what we needed to do.
Morning Breeze is now ahead of the curve as other facilities are figuring out how to enforce this federal mandate. It requires workers in healthcare centers that receive federal funds to roll up their sleeves by January 4th. Holly says for her team, one-on-one conversations made the biggest difference.
And the personal relationship with our team members. We're small, we're a family, and that gave us the opportunity to know why someone was hesitant and to be able to talk it through.
And the federal mandate will need to jump through some hoops before January, with pushback from several states, including Indiana. On Friday, the Attorney General announced a lawsuit against the requirements, which was endorsed by the governor. It's expected to be filed soon.